We're now live.
Thank you. Welcome to tonight's Adults and Health and Scrutiny Review Board, 4th of July, and it is currently 6:05ish. We are going to go through and just give a quick introduction. We've got quite a few new members on this board, and then afterwards I will do apologies if that's okay. So we'll go clockwise. I'm Councillor Ralston, Councillor for Spondon Ward. I'm
Dominic Monaghan, Democratic Services Officer. Thank you.
Councillor Wolf-Nice, Rob Region Ward.
Councillor Russ, Alveston North.
Councillor Jerry Pearce, Councillor for Chellaston East.
I'm Sean Thornton, Director of Communications and Engagement at the ICB.
I'm Beth Fletcher, Big Involvement Manager at the ICB.
Councillor Lonsdale, Little Over Wood.
Brown, Director of Joint Commission and Community Development for the ICB.
Sarah James, Exec Director of Strategy and Planning for the ICB.
Councillor Martin Repton, Darley Ward.
Councillor Clara Ashby, Abbey Ward.
Okay, lovely. I don't think we've got any apologies for today's meeting, have we?
Just Andy Smith.
Just Andy Smith. Okay, no problem. I haven't been given any late items. Any declarations of interests from members? No. Lovely. So we've got minutes held from the 18th of April. I don't think there was only Councillor Longsdale, I believe, who was on committee at that point.
Apologies
that day. So as much as we can, we'll have to pass the meetings as best to our knowledge that information was correct.
So if you're watching it on YouTube,
okay, lovely.
It seems as
brilliant. So we'll have to go from that point if that's okay. So before we go on to item 5, which is our update today, I just wanted to remind everybody this is a really important committee. I think there are a number of councillors that are very new to adults and health services. So I think we've all got a big learning curve ahead of us, those that have been councillors for a long time, but there are those that have probably a bit more experience than others, and we need to work together and create an effective scrutiny that works well for Derby. So on that note, we will move on to item 5, which is the update on the development of the integrated care strategy and the joint forward plan. And who is presenting that?
I think I'm starting then with the Treble Act and following some of the elements of that, if that's okay.
Excellent. Okay.
So again, I'm Sean Thornton, I'm Deputy Director of Communications at the ICB, you won't know this because you won't know, but I talked to the committee in October last year about our engagement strategy within the Joint Care Derbyshire system, the way in which we're trying to strengthen the way we involve people and communities in the work that we do and the planning that we do. So we're making progress on that. And I think that this agenda item was to kind of invite primarily then me back to update on where we are with the engagement that we're working on within the system. But actually it felt like the right time and opportunity to talk about how we've actually started to translate some of that into the strategies and planning that's been going on within, not just within the NHS, but within our integrated care system more broadly. So it felt best to sort of show a bit of that engagement strategy working in practice. And Zara and Kate will cover those. There's one bit about the integrated care strategy, one bit about the joint forward plan. I think we set that out in the paper, so hopefully colleagues have a chance to read the paper. But I think there's a bit of description about that as well. Just to, on your point at the start there, Councillor Ross, about the new committee, I think aside from this conversation, I think we're very keen to have a maybe not, I don't know, outside of committee unofficial, but come back and talk a briefing about how does it work and what we're trying to do within the NHS more broadly, and just to give members a chance to.
That would be brilliant, I think.
Hopefully, what we discussed tonight, you'll get a good sense of that to start off with, but we're not going to achieve it all in one meeting, I don't think. So that was the kind of just to set the scene. This is a kind of it's a coming back to talk about what something we spoke about before, but I think it's a good time to put it into context to the way we've used it and strategy and plans. I'll hand over to you. Nice. pick it up from there.
Shall we round up to do
We'll talk about the strategy first. So, and so my name's Kate Brown, and I've been involved from the NHS perspective in terms of the development of the integrated care strategy, which is a requirement of the new integrated care partnership, and that was formed following changes in legislation last year in July. So when the Integrated Care Board was formed, there was also a new requirement to have a partnership. So, and please do stop me if that's really familiar to everybody. But that partnership has on it representatives from both local authorities, and in fact it's chaired by the Health and Wellbeing chairs, with the vice chair being the ICB chair, and also has voluntary sector partners, lower tier councillors, organisations, NHS organisations, Health Watch on that committee. And one of its functions is to develop an integrated care strategy. So working with partners from across that, all of the representatives over the last few months, we've worked and developed that strategy, which was formally signed off in April. And then through your cabinets, the cabinet city and county in June. So it's now an official document. It's available. So I thought it might be helpful, particularly in thinking of the things that Scrutiny might be interested in, to describe how we develop that strategy from an engagement point of view, and how we plan to implement it and respond to the issues raised in it. So as part of developing it, we didn't want to go back out to communities to ask them what was important to them about health or care or services, because it felt like as a system, collectively, we've got a lot of intelligence, a lot of information, a lot of knowledge. And there's a danger of engagement fatigue with people continually asking them what's important to them, what matters to them, and the more and in terms of high level strategies and the direction, that it feels like that's pretty clear and pretty shared purpose. And actually, people are often more interested in the changes that might happen much more locally to them and how they can be involved. So we did do some. We sort of synthesised a lot of the intelligence and knowledge and insights that we had. And in doing that, also tried to identify where there might be gaps in some of that knowledge. And I think we're still doing that in terms of communities that might not then necessarily engage in the ways that people that, you know, in terms of ability to engage in things. And we particularly think about whether we do too much that involves digital, and people need to go online to get involved. And so there's still some challenges that we face in terms of doing that. But we basically took a lot of that information that we had, alongside a lot of public health information and information on various strategies and plans that we had as a system anyway, and we're working collectively on. And we wanted to make sure that we didn't duplicate any of the existing thing. It wasn't just a rechurn of what we've got, but that we added value by thinking as a partnership and thinking what we could bring in terms of working together. So the focus then has been to develop 3 strands. We'd already got across work that had been done as joint partnerships previously, a sort of life course approach of starting out well, staying well, and then ageing and dying well. So we used that structure to come up with the strategy. And then as part of that, I've identified 3 key areas of focus. So to get below those really high level ambitions about everybody should have a great life and live well and end well, to try and distill down into some things that we could then use to test whether our partnership is developing, whether we're making a difference, and the learning from how we work together. Because one of the things we found in terms of developing the strategy was the things that make a difference and to us achieving are often those enabler things. So it's how we do our workforce planning, how we share our data, how we use our resources, whether we've got shared purpose and culture, rather than we've picked a target and we're working to that target. So we wanted to test those out through those key areas of focus. And as part of the engagement around that, we have, and it was online, so we do recognise the challenges of that. We ran some online sessions to just share with people some of the case for change, some of the data and the insights that were driving those areas of focus, and to get thoughts and early input into how we might then respond to those. And we had 350 people over 6 sort of online sessions in doing that. The other opportunity we've had around engagement, we're working really closely with the voluntary sector as part of the development of the strategy, recognising their input right from the start is important, because often we bring partners in late in the day and then you've already on a particular course. And so it's really important that all partners help to shape the strategy right from the start, and the voluntary sector are a really important partner in that. And last week, there was an organised event where there was a launch of a memorandum of understanding between the voluntary sector and the NHS, part of this partnership. And we had over 200 people there, and again used that opportunity to focus in, to gather thoughts. And we had a share and contribute session where people could give their thoughts on those 3 key areas of focus around school readiness, around the major causes of ill health and inequality, and then also how we integrate our health and care teams to respond to people at the end of life and as people age. So we're trying to build on that. We've got a lot of work now to synthesise and theme and gather the information from that session just last week. And we're also, as part of the strategy, and if people do get a chance to look at the strategy, wanting to embed an ongoing engagement and insights approach. So these aren't one-off events. These are about us building the opportunity to listen, learn, adapt, reflect, and in terms of how we evaluate whether we're making progress, making sure that our population and the representatives of our population in whatever form are being part of that evaluation. So again, we don't just rely on quantitative metrics. We are drawing in and also our staff and volunteers in terms of whether they are seeing that we are operating more as an integrated system, and that because the main aim of the partnership is to look at how we can better solve those real significant challenges of health and care that affect the population. But by working differently and together, we can continue to improve how we do that with the resources we have, which we know are very challenging often in terms of the reality of the resources we have to work with and the expectations against as statutory and non-statutory organisations to deliver against those. So we're really wanting to embed that approach. So in terms of coming in and sharing that today, as Sean said, to show that from a sort of theoretical approach to engagement, that we've tried to draw that into how we've developed the strategy. But although I'm here from a health perspective, it is very much a partnership and could easily have had, if Andy Smith had been here, he'd have been having as much to say about this as I would. And it's similarly with the county colleagues. Councillor Repton, if you wanted to.
Yeah, I've been involved over the years in quite a number of discussions, debates and various strategies with the Health and Wellbeing Board, and they're all absolutely superb intellectually and good evidence of intellectual engagement. I guess in terms of us as local councillors, what we need to demonstrate at some stage, because the years have ticked by, and there are major challenges about resources, it's about demonstrating an actual physical and real and tangible improvement to the quality of services people access. And that's what they'll be pushing us as their local representatives, and I guess you guys from health, to demonstrate that. Because some people can be cynical and probably sometimes unfair about it's fine to have warm words, we tick all the right boxes about engagement, about listening to people and involving people. At the end of the day, it comes down to the elephants in the room, and they are the waiting lists, the lack of dentists, the lack of doctors. We've talked about more care in the community now for 10 years. I remember when I was chair of health and wellbeing. And the movement has been slow, far too slow. I understand sometimes turning an oil tank around takes a few years, but when it's almost a decade, then it's something that's how can we quicken that pace? I know it's the background of increasing demand and lack of resources, and they're the two biggest elements in the room. But despite those, it's saying despite those challenges, we need to individually and collectively pushing for that locally, nationally, for more of the person to pay for that. But over again, then it's making sure how we use that, hopefully increasing money more wisely, supporting more people in the home, and then also through these plans and have a timetable when we can demonstrate to our constituents that this is what we're looking at, this is why we're looking at, and this is what we hope you will see in 1 year, 2 year, 3 year, 4 year, 5 year, in terms of waiting lists, doctors, dentists, etc. So they're the sorts of things that a number of us, I think, are maybe a little bit impatient, but I'm sure you understand the questions that we're asked.
Okay, to respond to that. So, and I think probably some of those more specific NHS elements Zara will be picking up on. But in terms of the delivery of integration, I think one of the areas that I'm particularly personally involved in is the ageing well. And I think in the city, I think your constituents would see that the improvement from integrated approaches to that services. So looking at the way that the local community teams and social care teams are working in really integrated ways and working with the discharge teams from the hospital. And I think the benefit of that integrated approach, which is what the strategy is really aiming to embody, is shown in comparative the data in terms of delays in hospital for populations and the numbers of people getting the right care, remaining then at home and staying well. There's still improvements to be made, but the improvements that have been achieved in the city with the collaborative approach, I think it does demonstrate that some of those commitments are now bearing fruition, which aren't the same even locally in the patch. But the city, I think those data, which we're not always good at tracking the data and showing those improvements, but there are some of the information we've been doing under, I don't know if you've people might come across a way of us organising our services that we call Team Up, about using our teams and making sure they are integrating effectively. And in the city, that is showing results. I'm really happy to come back and share with you about how that is. We'll absolutely accept the challenge that we've got a long way to go, but I think we can show the progress that, particularly by working in that collaborative way, we've achieved.
I think that would be useful in terms of making sure that both elected members and the public are aware of what we're doing and why, and about the real achievements. And if there are the real achievements, then don't let's hide our light under a bushel. Let's make sure that we actually highlight that good practice, and then make sure that we push ourselves to build on that practice and not be complacent. Thank you.
Thank you. Absolutely. I think bringing back some future data on the impact of this is going to be crucial to us from a scrutiny point of view. It's great to see the integration plan and working together and the aspects of what can happen, how it will happen, but it's going to be crucial, as Councillor Repton says, to bring back that information to identify where there has been some excellent work and benefit data-driven results from that, but also those that need further improvements and things that we need to challenge or tackle or take further up the line. I think that's going to be key to all this. So I'll let you carry on if that's okay.
Yeah, that's fine, thank you. And if I could pick up Councillor Repton's question around the waiting times and the NHS aspects in what I share, that hopefully will be helpful. So the NHS tends to plan on an annual basis. So we have a set of measures, if you like, that NHS England sets for us and says, right, this is where you are, this is where you need to be, from April to March of the following year. What we've got and literally just published on Friday is a 5-year plan. So there's something about absolutely what the public expect around waiting times, access, from a workforce perspective, how do we get quicker access? How do we get treated quicker, have that care and, quality and experience, but also in terms of that speed and needing to deliver the key outcomes. So planning on a 5-year basis intuitively is the right thing to do, isn't it, in terms of being able to also very transparently say, well, this is where we are now, and yes, every year we're going to have to take stock of where we've got to, have we managed to achieve those metrics, but actually over a 5-year time period, that's really where you then start getting into the more sort of preventative measures, things that mean that people who currently are having to have, intensive treatment might, be better off in that future. And indeed, many things take much longer than 5 years, don't they? But if you don't start now, then you kind of never get there. So we've got the what's called the Joint Forward Plan, which is NHS England's language really around also looking, I suppose, what Kate's saying around, that broader partnership. But the reality is we have very much at the moment focused on what the NHS's contribution is to delivering some of those things that I've mentioned. So the publication is there obviously to read. And I think once the board here have digested that, it might be that we want to bring back conversations on certain aspects of it, because it's quite broad and far reaching in terms of some of the things that we're looking to do. It really clearly, I think, articulates that what we call the case for change. So, knowing why we need to change things, what the gaps we're seeing, particularly when we think about more preventative care, addressing the inequality gaps that we see. And obviously that's very apparent in the city and needing to close some of those gaps for our different communities. So that is articulated within the plan, but then we get into, but so what, how do we close those gaps? Where do we go? Through a lot of engagement and the insights work that Sean's referenced, we've come up with a set of sort of policy areas that we think we need to progress in order to take action. So there's one around our resource allocation. So we obviously have a finite amount of resource, for the population that we need to make sure it is distributed to the right areas. We often have conversations about whether we've got enough resource, can we do all the things that we want? And I think there's those honest conversations with the public that says we can't possibly do everything, but actually what do we need to prioritise? So we're certainly wanting to get more into those conversations. We'll be wanting to have those conversations here with you in due course as well. So resource allocation is really important, and trying to do what we call the left shift. So doing more of that upstream preventative type care as opposed to when it becomes to crisis or that treatment side of things, which will always be needed, but trying to shift the dial on the proportions of that is really important for people. And then the other area, which I think links to some of Kate's points around that integrated care strategy, is actually making sure that at a really local level, our team, so our multidisciplinary teams that work together who deliver that care, we know they are best placed often to make some of the decisions. The patient or the person in front of them, they know what to do with that individual. So having less of the sort of constraints around decision making in our system and really empowering local teams to do some of that decision making is another key sort of policy area for us that we need to take forward. And then there is something very specific, which is sort of linked to that, but around what we're saying, sort of control of people's care. So for the individual, when decisions are being made about their healthcare and the outcomes and what's going to happen next, they need to be central to that. And that's not a new thing or probably a surprising thing in terms of for the NHS and broader partners that we have been focusing on for a number of years, but we need to be more consistent with that people feel in control, can help to make those decisions and more personalised care for people. And then the next area, which is very sort of high on the agenda at the moment, I think quite rightly, given the resource constraints we've got, is about being as productive as we can. Are there areas where maybe, in terms of the different access points to care or how care is delivered, we can do it differently? We can help our tired workforce to work more productively and do better for them, but obviously importantly, be better for citizens and patients as well. So there's a real productivity and efficiency side of that sort of policy area for this plan. And then the final piece, which is, I suppose, what we call like an enabler really, but is really important, is around the data and the intelligence we've got and the analysis, that we share that with the right groups of people. They can then make really informed decisions. Some of that's around research and analytics, but some of it can be really, what I'd say, basic things about that level of data and information that people can give that sort of joined up approach and care. So those are kind of the different strands. We are constantly facing this sort of battle with the balance between the here and now, though. So, what are we doing in the next 12 months versus what 5 years looks like? And this is where we need to do, some really key things and then get into very measurable actions against those 5 different areas. So, for example, if we are going to put more resource allocation into different areas, we're not going to have more money. We don't expect to do that. So actually, how might we reprioritise how we do things? Are there ways that we could be more efficient as well to better spend the money that we have available to us? How do we use the workforce differently? So trying to balance the scales between here and now and the sort of medium term is something that we're working on sort of with real intent. I've mentioned around staff and people, but I think it's always important to just sort of remember how hard people are working, and you can't keep pushing people to do more with less. So that is a really key strand as well, and we are developing our local workforce plans. We've recently obviously received the government's national people plan as well, which we're digesting and seeing what that means for us locally. So that's going to be really important. And again, very happy to come back with colleagues to talk about that here as well. So there's been loads of engagement that's gone into the work, but it is at this stage, since Friday when we published it, it's a plan. It hasn't got all of the tangible actions yet. So over the next sort of 3 to 4 months, certainly before we get to winter, when obviously lots of operational pressures start to kick in, we want a really clear implementation plan. I'm really happy to obviously discuss those elements as well as we start developing. So I'll pause there, perhaps any questions.
Thank you. Are there any other questions from anyone else at this stage? Okay.
To come back.
Yeah, I was just going to ask, could you forward a link for the 5-year plan waiting information so that we can share that with the group? And obviously that's something we know will progress and change every year, but it's good to have a starting point, and that's the important element of this, isn't it? Let's get to the point where we know where we're at, where we're hoping to be at, and each year that's updated and changed, obviously with the changes that come in as we've progressed. Having looked obviously from historic information on this particular board, this has come to this board originally as part of the approach, isn't it, and to try and get a feedback from us. And obviously it's quite a short document on here, but I'm sure it's not a short document in process. So obviously, again, if we can share those links, we can go through that over this next coming couple of months, ready for October briefing, and anything that is highlighted within there. I personally would love your feedback in areas that we should put on our coming topic reviews or our work plan, and then we can tackle that, look back at what we've had historically, which I've got in front of me, and see where we can look at what we've already looked at in the past couple of years, what's new and coming to the forefront of issues for the NHS. Just off the top of my head, a couple of things that I've considered is the impact of mental health on people following COVID and back to work and things like that. But also vaping is something that, the impact, long-term impacts and the issues around that and potential impact on the NHS through that, as we're starting to learn more about it, and what we can do as a council to tackle some of that, especially in the young people. It's a big thing. I've got teenage children, and I was no innocent child. I was smoking much younger than I should have been, and these things are happening now, and that's something that we've got to look at, the future impact of that and how that's going to impact on us. Not when it comes, we'll deal with it. So that's something I'm quite keen to bring into our work plan. So in terms of this agenda item, then, have you got a little bit more to go through with us?
I think it's more of a kind of in the first meeting. I think I suppose just NHS probably tradition. You might not be aware yet, we've got legal duties around involving the public in service developments, and of course we'll bring those as specific items to this board as and when they kind of come up. And I think we've historically done quite well on that and being legally compliant. I think what we've found on the back of the pandemic actually was that we need to do much more in the NHS around those kind of community connections, and working with the local authority colleagues during the pandemic. Just opened my eyes, especially to the work we need to do with communities in developing our plans. So just one of the things I wanted to flag in the paper really was that alongside we've just got the legal duties and the really kind of quite stuffy formal consultation things that we know we're going to do, we will do in the future on whatever topics. Just wanted to flag in the paper that work we're doing on our insight framework, which sounds a bit jargony, doesn't it? But I think the bottom line of this is just making sure we're when working with local authorities and voluntary sector organisations, certainly not seeking to replicate what already happened, but capturing the day-to-day views of people in everyday life and trying to make sure we gather those and theme those and be able to feed those into decision-making processes. So it's just a bit more of a continuous discussion having with the citizens. There will be times when we have to do full, 90-day consultations on particular issues. But I think we'd like to think out. I think our end goal would be that they're not such big things anymore, because actually they've been the thinking, the planning, the strategy has been fed by views in the first place. So the consultation is much more straightforward. This is what we think you've told us. How does that look in practice? And I think it's one of the points of feedback from the October meeting last year was how are we better making sure we're capturing this information from the contacts that our staff have every day and we have every day. And I think that the model that's in there on the community insight is partly in response to that, and also partly being driven through the integrated place executive, which the Derby City partnership is part of. So I'm not going to go into the details, but again, I think it's something we're progressing that, and this conversation is taking place now about how we try and turn that into practice. So I think we've developed a model which we've known about. We're not getting insight from anybody until we've built a relationship and trust, and that people feel they can talk to us. So that's a very, very significant part of that. And then the kind of the crunching process of how do you theme that. But we're just trying to work on a tool now that can be piloted amongst any kind of level of organisation, and we can start to test some of this out. and see how it might work in practice. But again, I just want to really stress that we know that local authorities and voluntary sector organisations do this really well a lot of the time. The NHS is kind of playing catch up. We're not seeking to start things from scratch and replicate it. We want to just make sure that we're kind of working side by side on. We've only got one population, so we need to try as much as we can to talk to them once. I know that's a grandiose statement, but we don't want to fatigue people thinking they'd be interested in our specific narrow agenda when they've got lives to live and they've got their own issues and concerns they want to tell us about. So it's in the paper. I think it's a form. It's information, but I think it'd probably be really good to bring that back at some days to understand how that. And also with our colleagues in the council, so this isn't just an NHS initiative; it's working as a system. Hopefully, with some really strong results in the future. So I'll stop there.
Yeah, I think that's a really interesting concept to know that we've got our local area coordinators now working as part of our communities and place teams and things. And I think having worked alongside them, and I think all of us councillors will either know ours or have worked with ours or have got to know them, and those individual case by case issues and the impact, I think from my point of view, when we do surveys and you do online things like that, you get a lot of negative because a lot of people will scream and shout and want to have their say. And sometimes, like with anything in life, sometimes the positive goes unclaimed, if you like. So, and I think there's a concept of trying to get that information of what's worked well, how do we make that work well for others, and tackle, and also what hasn't worked well and how do we stop it happening to others. And I think working with the local area coordinators on an individuals basis and the GPs and various other things, and I think as councillors we often get feedback from residents and of what hasn't worked, and it's how do we share that information with you proactively and work together in taking that forward. I know there'll be sort of the complaints procedures and all the official lines of ways forward, but if we get something where somebody's saying to us, I just don't know where to go or what to do, and actually it's getting to know, everybody getting to know where they need to be or what they need, the questions that they need to ask, and the more we work together and integrate those services, I think it will be a real positive for Derby, and it is a brilliant move. We know, as you've already said, there is a lot to do. We know it's not perfect as it is, but there is also a lot of brilliant work that happens in the NHS. And the staffing, as you've mentioned, is a key part of that and the workload that they're doing. So again, mental health in their workplace. I know we have our mental health champions. I did have a badge on about mental health champions at one point. And having done that course myself, those are the sorts of things that we need to recognise, support our staff from a council perspective, and I'm sure alongside with you guys, that's a key issue because the productivity of individuals will be part of that. So just thank you for the report. Obviously, from our perspective, we need to digest that information, look at any targets, and as we move on to our next agenda items, we can start to raise any of those things that we want to bring back to go a bit more in depth with, and just see what we can do to recommend, or what whether that's working with our LACs or any other areas of the council that you think actually if we could have a bit more access and we can do them recommendations to help that, then we can do. As you've said, some of this is very high level strategic planning, and it's all very lovely in concept, if you like, but let's see how it works on the ground. So if there are any other questions, any other points? Excellent. Okay, so from my collection, it's just points to request is just that 5-year plan waiting list to circulate, and links to the actual plans, the joint forward plan, national people plan, and things like that, so that we can digest those over the next couple of months, and maybe have a non-formal meeting of questions and queries, a bit of internal training ourselves, to look at some upskilling our knowledge as a committee, so that we recommendations or formal strategic challenges.
just to add to the list, if it's okay, just maybe as part of the conversations, perhaps just with me and Beth, from an engagement point of view around the legal duties, actually, because
Yeah.
it's not straightforward as we've discovered in recent years trying to work under it. So it'd be good if just had a conversation about what you think legal duties look like and how they relate to scrutiny, and I think that'll help inform the kind of conversations and the way we try and pitch the agenda items going forward, if that's okay.
Yeah, I think
Helpful to you, hopefully.
100%. I think it would be useful. We have a lot of counsellor training that's just very overview specific, not really getting to the crux and crux of information. And I think it would be nice to be able to have that, you know, even if it's an online Teams for a couple of hours, a bit of question and answer sessions, anything that anybody's interested in learning a bit more about.
I just wonder whether the legal perspective is something that we should have as an agenda item rather than an opt-in.
Yes.
Thing.
Oh, absolutely.
But if Sean could actually come and.
Yeah, I think that's
so.
I think as we get onto the work plan, I do think that that's something that we need to, Sean very nicely, if he will come back and give us a formal briefing, but on the interim, just for myself,
have the training
and understanding from our perspective. But I think it will be important to have the scrutiny committee's formal responsibilities and things on that front. That'd be great. Okay, so we've then got item 6. Am I correct? Yes. Yeah, work programme. So that's straight into that. So having looked at last year's work programme in front of me, so I'll reel off what was looked at to give us an example of some of the things that we've looked at historically, and then I'll open the floor for any current things that people are interested in as an individual counsellor-led type approach, anything that people want to highlight. But then if we can take any other suggestions from yourself as to what we can look at. So historically, we've looked at NHS dentistry, provision of the people with chronic conditions such as ME, chronic fatigue syndrome, people and community strategic approach and engagement, primary care enhanced access report, waiting times and A&E hospital discharges, ambulance response times, orthopaedic centre, people and community strategic approach and engagement. Again, topic review was around obesity. So obviously I'm not sure in terms of the outcomes of that topic review, if that's something we wish to continue as a committee, or if there is a new current topic that we want to move forward with. Adult service for learning difficulties and autism, mental health in youth aspects 18 plus, waiting times for A&E, again, Derby and Derbyshire integrated care, strategic and just dentistry and voluntary sector contributions to health, and the Florence Nightingale. So that was what was on the topic reviews for last year. I have got the previous year, but we can all have a look at that individually. So I'm going to open the floor initially to any particular items. We'll go around the room to the councillors if there's anything that they specifically want us to review. Councillor Noah? Nothing particularly. Councillor Cluss?
I think A&E waiting time, so we can get some information on that, especially if it comes up in the past, and then we can keep an eye on if it's improving. And dentistry as well.
Okay, so to keep a sort of rolling briefing on that, on those numbers, and just to see how they're progressing over the next 12 months. I think that would be useful to have both the numbers and any impacts of rationale reasons behind them, i.e. if we touch wood don't have another pandemic or anything, that those are taken into considerations as part of the numbers. Councillor Pearce?
I think a revisit on mental health,
Absolutely.
if we could, please.
Yeah. Any particular aspect? I'm keen to help with or look into mental health in men.
Yes.
Particularly, I think that's something that's subject that often is something we need to work more on.
Yeah.
So not overlooked a little bit. Yeah. Councillor Lonsdale.
Well, it'd be interesting to have the Florence Nightingale Hospital beds closing coming back again, because it's just a thing to keep an eye on. Definitely mental health. Correct me if I'm wrong. Has our remit extended to include young people in this board, because I know my board, CYP, still can cover it, but I was under the impression that our remit had changed on this board, had changed slightly.
I've got it up here. We still don't cover young people.
Okay, so CYP is where the young people stuff is supposed to be. There was confusion. But yeah, what?
But that is part, as far as I'm concerned, it is, you know, progressing forward as we talk about looking at our long-term implications of our
Well, this is why we
population and things like that, and the impact of people, for example, with autism and number of and increases in etc. is something that we've got to consider as part.
This is why last year we looked at transition from youth services to adult services, and how we were doing with continuous care from a young person who is poorly is going to become an adult who is poorly. That was the purpose of that. And I think that is something we should be continuing with in some format.
Yeah, it would be interesting to have a sort of categories of those that are falling into that 16 to 18s that are coming through to adulthood and the impact that that's having. I'm sure that's data and information that you guys will have that can look to progress plans going forward, if that's possible. I'm looking for nods. Yes, lovely.
Effects on COVID as well. Continue that sort of, yeah. I believe there's increased issues in the heart area and things like that, isn't there? So, you know, what are we seeing coming through on the NHS with people who've had COVID who are suffering from new and interesting
So the long-term impacts of COVID and all that surrounds COVID, vaccination processes, everything like that. Councillor Repton.
It may not be appropriate, but I want to talk about autism, because autism obviously, I was thinking around the establishment of an integrated health, education and social care approach to funding, identifying and responding to young people's needs. So I'm thinking, because obviously those young people become adults, with obviously now it seems that autism doesn't seem to be very much understood going back like 2-3 decades ago. It is now. And I just wonder whether it was within the remit of this board or whether
we had it on the board last year that adult diagnosis of autism was part of our remit, but continued care of autism.
Well, if that's the case, then I think it's something we ought to at least be considering here.
I think it's the autism and the umbrella of autism and the comorbidity disorders that go with that. It's a topic close to my heart, Councillor Repton, as you know. My 2 boys are on the autism spectrum, and their comorbidity disorders, ADHD, sensory process, and all of those things. And that's just it's such a minefield of implications that are coming through. So absolutely, I think there's that what we're expecting to come into the system and how we're going to support them as adults that we already know of, but also as an adult myself who has started to understand this and know family and friends that obviously 20 years ago would have been diagnosed but weren't diagnosed because they weren't aware of it. How do they get the support that they need?
I think that's the key.
It's the knowledge, isn't it, that we now have, we understand it. That we're getting to that point where there is a select understanding, and we've got to make sure that that's shared across businesses, local businesses. You know, Rolls-Royce, for example, is a prime example of that. They've got some great strategies with their company and how much they help with people with autism, and how do we share that and get that out there to support, because it's that that sort of initial help rather than getting it to crisis point, as you mentioned earlier. What can we do to support that?
I think you're right, Nicola. It's this holistic approach. We start at an early age, because rather than say, oh no, we've got to cut off points, it needs to be joint services like health, social care, education, and it's about identifying, as I said earlier, about funding and about that approach. And I think that's a really good idea and important as well, about planning for the future, because we know we had an autistic counsellor who was working for Rolls-Royce, very, very good indeed. And I know Alistair Woodlands, that they've got their own autistic teacher. He suffered himself from autism. But we just need to be shining that spotlight on it and making sure that we do work in a coordinated way. And so I support any work that we could do on that.
Yeah, I think for me, again, like you say, it is a disability, but it's also another ability. And how do we get those individuals to fulfil their full potential,
Yeah.
and companies to help them to do that. Because actually I think that, if I'm deadly honest, I think that Rolls-Royce probably has a hell of a lot more autistic people in it, or other businesses do, when it comes to that analytical engineering mindset and brain. You know, we're all built in different ways, but I think it would be really key to look at how we can help companies to almost have a program of we've got a disability friendly awareness type program, haven't we, for businesses from the perspective. Maybe there's something that we can focus around both, you know, because a lot of people with autism and other issues do suffer from mental health because of the challenges they face around feeling like, you know, very different. And so all of that is very much encompassed as how do we work together to proactively support those people. So
could we also look at how we support people, because as many of you are probably aware, there is now a huge increase in adults coming forward saying,
actually, yeah,
I think
understanding
this may be me.
Yeah.
But it's getting diagnosis and getting the mental health support, whether it's autism or ADHD or a combination. That's a huge gap in provision.
Yeah.
So I think if we could look
at interesting to look at what
not just the long term and the health and wellbeing supportive stuff.
Yeah.
But it's the people getting diagnosed in the first place. I'm sure you guys are well aware.
And are we accepting people who are self-diagnosing because they go, oh yes, this is me? They cannot get diagnosis because maybe they are too high masking, maybe they are too, you know, too.
But that all comes under what I'm saying.
Yeah, exactly. So, you know, I'm adding to what you're saying.
It's whether.
I can always remember the day that I was told my eldest was autistic, and I said, well, what, you know, it was very new to me. I didn't understand it, and I said, so, you know, what can we do to help cure it or whatever, you know? And the one sentence that sticks in my mind is, his name is an autistic child, and he will be an autistic adult. And that's something that that's the sort of wake up call for me. That was something that as we as counsellors move forward, it's again, we've got to look at, we've got such a higher diagnosis rate than we've ever had before as young people. They will be young adults and adults going forward. So both of those, absolutely, we add that to the list, and we'll bring a bit more detail into that, and the comorbidity, the umbrella support. Talking of which, obviously we know that there is support out there in the communities for those people that helps take the pressure off the NHS and the voluntary sector and things that happen for adults. So a bit more information around that would be good. What is out there to support people? How do we create better social circles? I know they're not always the most social of people, but they still need that social integration and working together. So
could we also put on it looking at, because, you know, for all of the presentation we've had, is, you know, the starting well, the living well, the dying well. Can we have a look at what's happening with Live Well Derby and the preventative healthcare provision that is there, the lifestyle stuff?
Yeah,
which has its limitations, I am extremely well aware. But I think the provision for the levels lifestyle support is
brilliant. Absolutely. So so my final one to add to that list, if you like, is we've often talked about smoking and then long-term implications and alcohol and all those things.
Comes under Live Well as well.
But the vaping, that was the one thing I'd like to bring to this committee, really, what we can do to help tackle that, how we're approaching it in schools, making sure that information's out there, the correct information, because there's a lot of information out there that it's just, how do we get it, the support information out where it's, you know, it's often it's better than smoking, you know, that sort of thing. And it's kind of, you know, so again, that's something, a topic area, not necessarily a topic review, but something to bring back that we can and ask our colleagues here for some more information on long-term impacts and that sort of thing. So from yourselves, from the NHS point of view, are there any other areas that you think that we should bring into our work programme going forward? What, in terms of sort of anything up and coming that's coming up that we need to sort of know about? Obviously, we've got the legal responsibilities and things that we'll add to our work programme, as well as a briefing. Obviously, the work programme can be amended, and this is just a point I will put into try and timescale all of these things in over next year. There's no point in me saying we'll do this on this date and this on this date. We need to go back and make sure that fits in with the relevant officers and things. But is there anything that you would recommend that we focus on, or?
I suppose, I mean, as we get into the delivery of the strategy and plans, there'll be things that come out of that specifically, initiatives that we start to develop from that. But I just wondered if it's kind of quite quiet in the news at the minute around pressure on the system and discharge, and I think maybe something like that went to plan as we get into the
Let's be proactive.
Just so partly as a briefing, if you like, but also just a bit of an assurance piece around what's happening to try and manage through the winter.
Absolutely. Just linked to that, I think there was a suggestion about the A&E side of things. I think it's probably linking some of this stuff together because they all connect to each other. Often pressures in an A&E department is linked to discharge issues from beds and many other things, and the ambulance waiting time. So we have previously brought through almost a package of things because they all do connect to each other. So I'd probably suggest doing it in that way, if that makes sense. And then, so just a wide point, we might, if it's okay, bring some public health colleagues to talk about some of the areas you mentioned. The smoking one is a good example where that would be great. I think that would just give a broader sort of understanding of some of the work that our public health colleagues lead on, as well as the NHS is doing.
Yeah, and obviously we've talked about working together in the teams and the council teams. Obviously we have our licensing department that tackle some of those rogue vaping things, and what issues are we finding, how is that impacting, because I don't know the ins and outs and details, but it's again something that if we can, the public health and that at the same time, how do we get that message out? Councillor Longstaff.
The discharge thing that you've just been talking about is very relevant. I wonder if that is a work, because it's very complicated as well. Is that a worthy topic for possibly a topic review subject that we might consider for the topic review aspect of this year? I mean, I don't know how we got on with the finishing off the obesity topic review, Dominic, but I believe we were fairly close to having a report.
There's not a report on that. I can share the notes from the meetings we had, and then some members of the board can decide if they want to take it any further, but we didn't get to the stage where
didn't get to that stage.
I think if we share those minutes and then perhaps have that as an item for discussion on a work programme. I think for me the topic review is sort of up between discharges and the wider scale of the.
Chef, how do we make sure that we're realistic in terms of how much we're taking on and the time scale? Because there's nothing worse than having 7 or 8 really noble ideas and just not touch the surface of anything. And then it's a question about, do we need to prioritise? What's the time scale, and what can we realistically do, and who's going to be doing it?
Absolutely. And I think and this part of this conversation is, what are our areas of interest? Let's take them away, put in a work programme, and then tackle which are our priorities in terms of topic review, if you like. I'd almost do those as focuses.
Would it help if we decided tonight to prioritise, or do we lose 3 months? Because I'm just thinking we meet again now to October.
I was hoping, if it's okay with everybody, that I circulate a plan. That then we feed back into, I might also circulate before I circulate a plan. Send out the list and ask you to prioritise all of them individually, and then we can work out on the plan where that fits in an appropriate time.
You get priorities then, wouldn't you, if everybody's going for 3 or 4 of those items?
Absolutely.
If we want an autism license.
Okay. So, and also obviously it's timescales wise, because the October one will be really useful to have the winter plan.
I was just going to say that has to be winter plan
and the ambulance. So obviously we will ask for that to be in as part of the October plan for our NHS colleagues, and then look at realistically which of the topics we've identified as areas of interest today. I'll circulate that as a list of priorities, and then we'll try and tackle them, because we are, touch wood, we're we're going to hopefully be static for 4 years now, so we've got a time. We talk about other people having a 5-year plan, and the whole point of all our elections was that we can plan more efficiently. So maybe that's something we look at doing. It's obviously that can be changed if things do change over time, but if we ourselves put in, this is our current priorities, and let's look at the next 2-year plan where we want to be, and then we'll go from there. Does that sound okay?
Yeah. Yeah.
Okay, brilliant.
Right.
I think then, just to clarify, that is the end of tonight's meeting. Any other business? Councillor Noas? No, Councillor Gough? Councillor Pearce?
No.
Sean? Beth? Longsdale? Kate? Zara? Brilliant. Thank you all very much for coming, and brief meeting for this meeting.